Hello, I'm Dr. Michael Reedman. I'm president of Maryland Primary Care Physicians. From the early days of the COVID virus, we've taken every precaution to protect you and your family and our staff from spread of the disease. On the early stages, we were 80% telemedicine visits. But now as we transition to more live visits in the office, we'll continue to take every precaution to protect you and your family. The following video explains some of those steps we are taking to protect you, so please take the time to view this video.
At the Annapolis office, we ask that patients come in like normal wearing their masks and get checked in. If we are not able to take you back immediately, we will ask you to have a seat in your vehicle and we will call you when the provider is ready. We have installed protective glass and are taking extra precautions, including sanitizing of all common areas.
During this pandemic, Maryland Primary Care Physicians of Arnold is taking great pride in caring for all of our patients. We started seeing patients in our Curbside clinic in the middle of March. The goal of our Curbside clinic has been to continue to see our acutely ill patients in the safest atmosphere possible, while continuing to see healthy patients in our building. All of our staff is supplied with full PPE while working curbside. This is to keep our patients as well as our staff safe. Patients with any concerning symptoms are being triaged by our nurse. She will then decide if the patient requires an evaluation outside or if they are safe to be seen in our building. During a curbside visit, our patient will be checked in, verify any insurance or information changes. A medical assistant will then take vitals and perform any point of care testing, such as flu, strep, or mono tests. These results are available within about 10 minutes. The patient will then be evaluated by one of our providers, and COVID-19 testing will then be performed if it is necessary, based on patient's symptoms, medical history, and exposure. We are able to generate referrals for specialists or imaging and send prescriptions during these visits.
Here at the Pasadena office, our safety program starts in the phone room. All patients are screened to assure they do not have active COVID-19 symptoms. Those who do are scheduled for a telemedicine visit with their provider. The provider decides what the first step is in their treatment and follows their care as they progress and get better. We have placed certified medical assistants at the front door to take each person who enters temperature and again ask the screening questions. We have social distance the seats in the waiting room, so if capacity has been met, patients will be screened, their phone numbers taken, and they will be asked to wait in their cars until time for their appointments. We are directing patients to leave by a side door once their visit is completed. We have placed social distancing markers and arrows where needed.
Maryland Primary Care Physicians is performing COVID-19 testing for our patients in our central laboratory. What you need to know about COVID-19 testing at our laboratory is that first and foremost, you have to have signs and symptoms of COVID-19. And if you do, you should schedule a visit with your primary care physician at the office at which you are a patient to discuss those signs and symptoms to evaluate whether you are a candidate for diagnostic testing. Keep in mind, testing reagents are limited, so only patients meeting the CDC guidelines will be considered for testing. Have your primary care physician collect a nasopharyngeal specimen and submit it to the laboratory. Patients can be scheduled to have their specimen collected while they are in their vehicle at our laboratory parking lot, providing you had a visit with your primary care physician in person, by video, or by phone, and meet the CDC guidelines for diagnostic testing of COVID-19. Results will be available the next business day. We are also offering antibody testing for COVID-19 to all PCP patients at our facilities. This testing is a venous blood draw performed by your provider's medical assistants and will be sent to the primary care laboratory. The results will also be ready the next business day.
So, I hope the video was informative. As we move forward to the transition to more live visits, we hope you and your family will continue to feel safe in our offices and know that you will get the high quality of care that we've continued to provide to you over the years. If you have any questions, certainly feel free to contact our offices about how to schedule your visits, and if needed, continue to have a telemedicine visit. Thank you for your attention.